Microvascular surgery, a detailed overview. Microvascular surgery, also called microsurgery, refers to surgical techniques performed on very small blood vessels, usually less than 3 millimeters in diameter, and nerves using specialized instruments and magnification via an operating microscope. It is a vital subspecialty of surgery with applications across reconstructive surgery, plastic surgery, neurosurgery, and other surgical fields. Principles of microvascular surgery. 1. Magnification. The use of an operating microscope or loupes to provide high magnification for precise handling of tiny structures. 2. Delicate handling. Specialized instruments designed for atraumatic handling of small blood vessels and nerves. 3. Fine sutures. Suture materials such as 9-0, 10-0, or finer are used to anastomose small vessels and nerves. 4. Continuous blood flow, ensuring patency of the reconstructed blood flow by achieving tension-free and leak-proof anastomoses. 5. Teamwork often requires a highly skilled surgical team as it involves prolonged and complex procedures. Instruments used in microvascular surgery. 1. Operating microscope, high-resolution magnification with adjustable focus. 2. Microsurgical instruments, fine microvascular forceps, needle holders, scissors, vessel dilators. 3. Microsutures, nylon or polypropylene sutures of 9-0 to 11-0 caliber. 4. Electrosurgical devices for coagulation without damaging surrounding tissues. 5. Microvascular couplers used for quick, efficient anastomosis of vessels. Techniques in microvascular surgery. 1. Vascular anastomosis, end-to-end anastomosis, connecting two cut ends of vessels. End-to-side anastomosis, connecting the end of one vessel to the side of another. 2. Nerve repair, epineural suturing, suturing the outermost layer of the nerve. Fascicular repair, aligning and suturing individual nerve fascicles. 3. Tissue transfer, free flap transfer, moving tissue, skin, muscle, bone, from one area of the body to another with its blood supply reestablished through microvascular anastomosis. 4. Lymphatic surgery, lymphatic cavernous anastomosis, connecting lymphatic vessels to veins to treat lymphedema. Applications of microvascular surgery. 1. Reconstructive surgery, free flap surgery, used in reconstructing defects from trauma, cancer resection, or congenital anomalies, e.g., radial forearm flap, fibular free flap. Breast reconstruction, deep inferior epigastric perforator, DIET flap, or transverse rectus abdominis myocutaneous TRAM flap after mastectomy. Head and neck reconstruction, following cancer resections, reconstruction with free flaps, e.g., anterolateral thigh or fibula free flaps. 2. Trauma surgery, reattachment of severed fingers, hands, or limbs, repair of crushed blood vessels or nerves. 3. Neurosurgery, repair of intracranial aneurysms or vascular malformations. Bypass surgery for cerebral ischemia, e.g., extracranial to intracranial bypass. 4. Vascular surgery, arteriovenous fistulas for dialysis access. Limb salvage procedures in peripheral vascular disease. 5. Lymphedema treatment, lymphatic covenous bypass and vascularized lymph node transfer to manage chronic lymphedema. Steps of a typical microvascular procedure. 1. Preparation, patient positioning, sterile field setup with all microvascular instruments. 2. Identification of structures, identifying and isolating target vessels or nerves. 3. Anastomosis, precise suturing of the vessels under magnification. 4. Verification, checking blood flow using Doppler or indocyanine green angiography. 5. Closure, closing the wound with minimal tension to ensure proper healing. Complications in microvascular surgery. 1. Thrombosis, failure of anastomosis due to blood clot formation. 2. Infection, risk of infection at the surgical site. 3. Ischemia, insufficient blood supply to the transferred tissue. 4. Nerve dysfunction, incomplete nerve repair or scarring. 5. Flap loss, partial or total necrosis of free flaps. Advances in microvascular surgery. 1. Robotics in microsurgery, robot-assisted microvascular procedures for enhanced precision. 2. 3D printing, customized grafts and models for preoperative planning. 3. Tissue engineering, development of vascularized tissue constructs. 4. Biological glue, fibrin-based glues for better tissue adherence. 5. Augmented reality, visual overlays to guide vascular and nerve repair. Future directions, nanotechnology, development of nanomaterials to support microvascular repairs, improved imaging, advanced imaging for intraoperative vessel mapping, gene therapy, enhancing healing and tissue regeneration. Conclusion. Microvascular surgery has revolutionized modern surgical practices by enabling precise repair and reconstruction of small vessels and nerves, improving outcomes in complex reconstructive and trauma cases. Advances in technology, coupled with skilled training, continue to expand its scope and success.